Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Hi, I'm Dr. Carrie Bennett. I'd like to talk to you about how we diagnose or detect breast abnormalities. One of the most basic ways is self-breast exam. Self-breast exam is done using the flats of your fingers from your clavicle over to the edge of what we call your latissimus, or over here by your armpit, underneath the inframammary folds and over to your sternum. It's best done in the shower with soapy hands or lying down in bed. And you want to feel like a jazz player with the flat of your fingers. You can even use your whole hand. So many times people say to me, I don't want to do it, it causes me too much anxiety. Well, one of the ways to help prevent disease in the breast is to learn stress management, to learn how to face our fears, step through them, and not allow the physiologic effects of that stress to constantly live within our bodies. So we want to help manage that. Fear-based decisions always backfire. Self-breast exam has been controversial, but the bottom line is it's painless. It doesn't cost any money, and it still helps people find breast disease. We do recommend that you do it when you're postmenopausal, that is when you don't have your period. Just pick a day of the month and try and do it once a month, but no more. And also if you get your period or your menses, the best day to do it is day 4 or 5. We recommend using an app on your phone to keep track of when you're getting your period. That will help you in probably any type of clinician's appointment. They're going to be asking you that question, but then the breasts tend to be softer and less nodular on day 4 or 5. Often your flow is changing, and that is the best time to do self-breast exam. And you'll see some pictures here, hopefully, that will show you some of the ways you can do it. But you can do it in a circle, you can do it like it's a bicycle, like radially, you can do it from the middle to the outside or the outside, whatever way you want. But you want to get a sense, and what you're looking for is something that stays for longer than 3 months. Especially if you have your period, you're going to get lumps and bumps. But 80 to 90% of those, especially with the fiber, fluid, exercise, stress management, good sleep, washing off your deodorant, and not wearing underwire or stiff cup bras, 80 to 90% of those masses will go away in 3 months. So it is important to have that happen. You can notify your clinician as soon as you find it if you'd like to, but often we'll try and do those kinds of things to do that. And then if it persists, then we'll do the mammogram or ultrasound. What is important, there are things that we feel in the breast and things that we see in the breast. And you'll see the Venn diagram hopefully here. And sometimes we see things, but we feel things, but they don't always overlap. So sometimes we see an abnormality on mammogram or ultrasound, which is two of the diagnostic modalities. Ultrasound uses sound waves and helps us determine if something is cystic or solid. Mammogram is an X-ray, which can be done in what we call a 3D way for dense breasts. And that would be that the machine sort of goes around you. Like when you go to the dentist, it's called tomography. The machine goes around you. And then when you're in a mammogram, there are 2 basic views. There's the CC view, or when the breast is pushed like this, cranial caudal. And then there's MLO, medial lateral oblique, side to side with a little bit of a tilt. So self-breast exam is a way to determine things. You can feel things or see things. If you feel something that's more persistent than 3 months, if you're premenopausal, that is, you still have your period, or if it's present in a postmenopausal person, we want to get a mammogram or ultrasound to evaluate if it's a cyst or solid. For many people in their perimenopausal time period, they will often get a big cyst in that last year that they're having a period or menses, but we do want to evaluate it. And then if there's something that we feel that's persistent, that is something we're saying persistent and palpable, something that we can feel, that's also what we call discrete or dominant. It's something feels like a pea or a walnut or a balloon that's sticking out from the tissue. We will often do an incisional biopsy either by the modality that's easiest seen on. So ultrasound's the easiest, to biopsy things with, or mammogram, or if we've done an MRI and it's only seen on MRI, we'll do the MRI biopsy. Now that said, some of the MRIs we'll try and do via ultrasound if we can, because it's easier for the technician or radiologist and it's easier for the patient. And then the things that we cannot see on mammogram, ultrasound, or MRI, but are persistent for greater than 3 months in a premenopausal person, or more concerning in a postmenopausal patient, we will do a core biopsy in the office. So just because you don't see it on mammogram, ultrasound, or MRI, it may still need a biopsy. And this is actually one of the most common causes of delayed diagnosis, is someone has a mass that we don't see on imaging, mammogram, ultrasound usually, and it stays and it might even be growing and nobody samples it. That said, the other thing we see is that 80 to 90% of these will go away with the recommendations of the breast health sheet, which you can watch at length in the other video. So to summarize, detecting breast abnormalities can be done by things that we feel, by you, the self-breast exam, or what we call the clinical breast exam. A clinician examines your breasts. It can be also found on mammogram, which is nowadays the most common way that we find abnormalities, and those findings are usually calcifications or a density. Calcifications come from cells growing and dying, and then your immune system bursts open the cell, and all the stuff inside the cell comes and out into tissue. So sodium, potassium, chloride, but calcium is one of those things, and we can see that on mammogram. So again, self-breast exam, clinical breast exam, mammogram, ultrasound. Ultrasound will help us know if it's a cyst or more solid, and MRI. Those are the most common ways that we detect breast abnormalities.